you opened this direct primary care. Tell me about the types of patients that come to you. Do they not have insurance, or do they have insurance but still want to see you kind of as a supplement to their insurance? What's kind of the standard patient?
So
for you?
that's a great question, actually, because a lot of people think, well, but I have insurance. Why do I have to come to your doctor? So first off, direct primary care aims to solve that access problem. I would say that's the first thing, is the access problem. Because sometimes you have insurance, you have great insurance, but you can't get in to see your doctor or, for 4 or 5 months. Because the average doctor, I would say, carries probably about 2,500 to 3,500 patients on their panel. And even if you were to shuffle that number, divided by, say, you're seeing 20 patients every day, 5 days a week throughout the year, I don't think you'll get through the 3,500. Some people have insurance, great insurance, but I always say, when you have insurance for your car, you don't use that to go get your oil changed, right? Or your tires tweaked. You save that for when you have a bad car crash, right? So I think maybe that's a better way how insurance should be used. So some people have insurance but don't have access to their physician. Or you have a really high deductible, which is where you have to pay X amount out of pocket before the insurance company is even going to kick in and, look at you. Case in point, my daughter had to have an MRI a couple of years ago. And even with our insurance, covering a portion of it, I still had to pay about $1,500 for that MRI because we were billed about $5,000 for that MRI. And so that's one subset of people who actually have insurance but don't have access. Now, there's some other people who don't have insurance at all. And the truth of the matter is, because trying to get insurance yourself, if you're not working a corporate job, when you work a corporate job, it's a little different because, yes, the dollars come out of your paycheck, but you never really saw that money. So you kind of don't feel it as badly. But either when you're a small business owner or you're not working, with a big corporate job where your employer is providing the benefits, now you don't have healthcare. Trying to buy it yourself through the marketplace, it sometimes can run up to $600 a month for one person. That's a lot of money if you have a family of 5. And so when people have to sacrifice between, do I pay these bills or do I go to the doctor? Nah, I'm healthy anyway. I don't need the doctor. So they always put that aside. But I always say, your body whispers until it starts to scream. You want to catch the whispers before they become a loud scream. And so preventive care is really, really the bedrock